Hey everyone, we're here together again. Hey everyone, we're back. We're doing our business highlight in the Bethlehem area. We're so happy to have our guests today. My name is Yoma.
And my name is Romeo. We have two amazing nurses. This one's very special because we have my wife, Lauren, and her bestie, Christelle. And both have different experiences with being a nurse. So we're excited to kind of hear the journey and what kind of made them become a nurse. So we'll start with Lauren. Why did you decide to be a nurse? What has the journey been like? What does the future look like for you? Who inspired you to be a nurse? So just introduce yourself and just give us a little something about yourself.
All right, so I'm Lauren. I initially decided on nursing in high school, so I've always kind of wanted to do like community service. I've volunteered for Habitat of Humanity. I've done Key Club, a couple different clubs during high school, and decided to, stick with helping people, but wasn't sure what it was. And then looking at my parents, kind of like that helped me figure it out. Both my parents were in the service. Dad was Army, Mom was Air Force, and my mom was actually a flight medic, which I thought was really cool. She traveled all around the world, helping people, saving lives. So I thought that was amazing. I was like, I definitely want to do nursing. So
we're going to go ahead and have the same question for our next guest.
Thank you. So, hi everyone. My name is Christelle. I didn't know I wanted to be a nurse right away. I started nursing later in my career. I did my undergraduate degree in neuroscience and I didn't like it. I knew I wanted to be in medicine. Like Lauren, I was in various clubs involved in community service and helping people, but I wasn't sure what path in medicine I wanted to take. So I worked as a medical scribe for a couple years in the emergency department, and deciding between med school, PA school, and nursing school, I ultimately ended up on nursing because nursing actually has the most contact time with the patients. Physicians and physician assistants don't really get to spend as much time doing the actual caring for the patient. So that's why I decided on that. What was the other question?
What inspired you to just keep going? What does your future look like as a nurse?
Okay. What inspires me to keep going is just the fact that I'm passionate about caring for people. That's not to say like nursing is a hard job. It is not easy. There's a lot of trials and tribulations. There's a lot of, it's a lot that you carry with you. It's not an easy task to be able to see people in their lowest state, in their most vulnerable state when they're sick, to remain like, professional and almost kind of like care for patients without being too emotionally involved sometimes, because there's like some things, like there's some hard cases that you'll see that is hard for you not to be emotional, but you keep your face on and then you cry in the bathroom or do whatever you need to do to take care of yourself. But just that key of caring for people is just something that I'm really passionate about. My future for me is actually a little bit different. So the hospital is actually paying for holistic nursing program, and that's something I've always been interested in. I think it's a great way for us to actually see patients as whole people and not just their diagnosis and what they're here for, but you actually to treat the whole person. So I finished my holistic nursing class March, and then I'll be able to sit for my boards to become a certified holistic nurse. So that'll be my path.
Oh, nice.
I don't know what happens after that, but we'll see.
Figuring it out.
Thank you, ladies. So we want to go ahead and delve in a little bit more. First of all, what are the specialties or areas of specialties that you guys are doing in your nursing careers?
So right now I work as a patient care manager on a cardiovascular telemetry floor. My nursing career spanned a few different specialties. I started off on a low-level trauma floor. Just to clarify for those who don't know, there's high level or critical care level, which is the ICU. So those patients are the ones that are on life support. They need a ventilator to be able to survive. Low level is a step below ICU. So it's like a PCU or intermediate care. I started off on a trauma PCU, but right now I'm just on a cardiac floor. still low level. And then there's med surg, which is they're sick enough to be in the hospital, but not really requiring extensive care. Other areas are like OR, OB. There's like so many different areas of nursing.
So I'm currently in like same day surgery slash PACU, which is like the recovery unit. So prepping patients before surgery, monitoring them afterwards. I started in the ICU though. I did burn ICU for like almost 2 years, and that was a lot. I learned so much. It was definitely a good experience. It was ICU and med surg, so I got a little bit of both. But now I'm mainly focusing on surgery, but not in the OR specifically. It's just pre and post. And I travel doing that as well.
Okay, I'm gonna rewind it a little bit. Kind of go to like the schooling and the early journey of nursing. So first of all, we'll start with the schooling, like the different kind of schooling and colleges that you attended to become a nurse.
So that's where me and Christelle met at Moravian.
Go Hounds.
Go Hounds. We met on the track team, actually. We both did track at Moravian. And I went straight into nursing. So I did the 4-year program. So I have my BSN. There's a couple different tracks. So you can do the 4-year, you can do 2-year accelerated program. There's LPNs. What else?
You can get your associates to RN.
Yeah, there's a couple different avenues. Yeah.
Like I said before, I didn't go into nursing right away, and it's funny because I was thinking about nursing my freshman year at Moravian, but a lot of the girls that were on my floor were in the nursing program, and one of the professors, she's one of the best professors ever, but she's tough. She's a tough cookie, and the girls would be crying in the hallway, talking about I got some 47 on my anatomy.
Stress.
And I was like, oh, I'm not taking anatomy. I'm not taking anatomy with Dr. Fox. But then I did neuroscience, and she was the head of the department, and I ended up taking neuroanatomy with her, which was even worse. But so for me, because I already had my undergrad degree, I just took my prereqs for nursing school at community college just to get some quick credits that didn't cover me from whatever I did in undergrad. So I needed stats, nutrition, those random off classes, anatomy, physiology, things like that. And then I did an 11-month accelerated I did an 11-month accelerated program at Drexel. And that was my BSN. So that program was very rigorous, but it was quick, and it was just full nonstop nursing. So you didn't have to worry about any of the other prereqs. Everybody was there for their second degree and decided to go for another career path into nursing. So it was 10 weeks of learning. Week 11 was finals. You had a 1-week break, and then you went into the next quarter right away. So it was September to September.
Intense.
Very intense, but I did my thing. I graduated with 3.9.
Yes.
High honors, so I definitely was a lot more focused and more passionate about this career choice, and so that's why I did a little bit better this time around. Moravian was just a little fun time.
Yeah. I was stressed, but it was fun.
But you did nursing. I think nursing nursing they say is one of the hardest undergraduate programs that you could take.
Yeah, I think people don't realize that. There's a lot to nursing. We're not just wiping butts. We're not just putting people on the bedpan. There's so much. We have to actually think and use our brain. Science classes, anatomy, chemistry, pharmacology. You need to know medication. It's not just we're not just standing there and looking pretty. We actually do a job. So it's
right. That's the thing. And just to jump on that too, it's just kind of we wear so many hats at the bedside that people don't really appreciate, especially I graduated nursing school 2019, had orientation for 3 months, and I entered my nursing career during the pandemic. So Lauren had the luxury of knowing what it's like to be a nurse before COVID. I only had a couple months, and then I got thrown into this debacle. And it was a lot because a lot of people were not willing to go into the rooms. Sometimes doctors in other hospitals that I've heard and worked at weren't even going into the room for the code. They were calling orders from outside the door.
Yeah, I witnessed
nobody
that.
Nobody was taking garbage out. So you became housekeeping, you became IT, you became, facilities, trying to like plug things up together. Nobody was really doing anything except for the nurses. And, a lot of us got really burnt out because of the amount of pressure that we were under to be all of those things, and also be the one that's holding somebody's hand when they're dying, because we weren't allowing visitors because of the pandemic. So it was a lot.
Yeah.
It was a lot.
To say the least. Yeah.
Yeah, like COVID for everybody was tough, but I can only imagine for nurses, just like a whole nother level. So definitely give you guys props. I know living together, like COVID was tough, because sometimes the problem came home and I didn't really know how to help. So yeah, COVID was tough, to say the least. For you, Lauren, I've heard about you becoming being a nurse at the burn unit. So because that was the first place you went when you graduated. So like, what made you want to go into that? Because everything that you've told me, like it was tough. So like, what did anybody give you a heads up? Like, oh, it's gonna be wild. It's gonna be a wild ride.
Yeah. When I told people I was going into the burn unit, all I got was crazy looks. Like, that's literally, people are like, you're insane. I'm like, well, I'm actually interested in it. Like, when I had my clinical there, like, it wasn't a lot of time, but I did like have my clinical, and then I did my research, and like the burn unit that I worked at was at Lehigh Valley. They're amazing. Like, it's like one of the top-notch burn units in the U.S. They're really, really good. They know what they're doing. And I love that it was like both too. You had med-surg, you had ICU, you get a little bit of both. You learn so much within your first year being there. I just really liked like all that it encompassed. Like, I thought it was really good.
And then the challenges.
Yeah, it was definitely challenging. Starting out in the ICU as a new grad is definitely hard. They always say to go to med-surg first, which is kind of like Christelle was saying, like the lowest level. You kind of see a little bit of everything. Not everybody, they're sick enough for the hospital, but they're not like necessarily in depth. They can definitely turn into that. But it's good to get your feet wet and learn that first. So I kind of like dove right in, was hoping to get more of a med-surg experience, but it kind of just jumped into ICU because all the floors are short. So you kind of just, you get training, but they can only do so much if they have, if they only have a couple nurses to teach you, you kind of just have to do your thing. Like, I remember doing training, because it's ICU, it's 6 months training. Like, I think regular med-surg might be like three months. Yeah, so ICU is like 6. And I think towards the end, I was taking like full-blown like burn patients by myself, like which you're supposed to, but like it was a little bit earlier before that. I was just taking them by myself and just figuring it out as I go. Like, you just do what you have to. You end up taking charge too. Like, there's usually a charge nurse that they try not to have an assignment because you're helping everybody else on the floor. You're making the assignments. You're making sure everybody's okay. If there's a code on the floor, you're the one that's helping out and, assisting everybody. I think there was 4 new grads when I started on the burn unit. By the time we ended, it was like me and like one other girl. So it's, pretty tough. A lot of people don't make it through or like last very long. So intense. And then also, there's always this term that nurses eat their young, and it's very true. So older nurses aren't always as kind and like willing to teach. So you just have to roll with the punches and learn as much as you can.
Wow, this is all very interesting, like a behind-the-scenes look at things. I am a little interested about how you guys manage your work stress and the burnout. So what are some things to do to cope with that?
So Lauren and I, we spend a lot of time together outside of work. It's funny, we work in the same network, but we work at different hospitals, but we always meet together, and we'll do spa days or just the having girl night, game night, just anything. And it's funny that you mention it, because part of the holistic nursing program, the basis of the program is to be able to fill your own cup first in order to be able to take care of other patients. You can't do your best work if your cup is empty, because you're more likely to make mistakes. Like, there's research that supports this, and it supports self-care. So now that I'm not on the bedside anymore and I'm more in the management role, I am working with the hospital leadership at my facility to be able to get like a respite room or a recovery room for staff to be able to like go and meditate. Like, I'm trying to, fingers crossed, we can get a massage chair in there. I'm trying to get like a salt lamp, aromatherapy, and do all those things. Other hospitals have this not network, but like nationwide, having these little recovery rooms, and like some of them even have journals. So one example that was presented to us was that like a nurse had her first code, and she was like, I'm a new grad nurse. Like, what did I do wrong? Like, does it get better? And I was telling Lauren, like, you don't really feel comfortable in your nursing skin at least a year and a half to 2 years of nursing. Like your first year, like your stomach's gonna hurt all the time. You're gonna be anxious. You're gonna be double, triple checking everything. You're gonna be questioning everything, just because it's like, it's so scary to have somebody else's life in your hands. And to me, like, being a safe nurse is being a scared nurse, because a scared nurse is gonna ask questions. They're not gonna do anything without like double checking, like, hey, is it okay if I give this medication? Does this make sense? Even if you have to bother the doctors, and that's like a whole that's a whole other
dealing with attitudes,
dealing with the especially because I work night shift. Like, they don't like to be disturbed or woken up for things, especially like you have a hospitalist doctor that's like always on call, but then like if you have a patient, especially when I worked on the trauma floor, like if you have to talk to the surgeons, like sometimes surgeons can be a little they can be a little rude.
A lot.
They will chew you out. But just, taking that time to self-care. But anyway, back to that nurse, she wrote in the journal, and then a more seasoned nurse like responded like, hey, it's going to take some time, but you're doing great. We're here to support you, and just kind of having those resources available for nurses to be able to take care of themselves. And most hospitals also have like therapists that are like included in like the packages and stuff like that. So that's pretty much what that is about that. So
I think it's important too to have a work-life balance. Like, I feel like it's easy to get engulfed into the career and just like only focus on that. Like, go to work, come home, go to sleep. Like, it's just like a rotation, especially working 12-hour shifts. You don't get much time. If you're working all your days together, you don't get much time to yourself. So it just feels like you're in this rotation where you don't like have a chance to breathe. But I feel like doing stuff on those days off, like being with friends, trying to get that, try to get that stress off of you somehow.
And that routine.
Whatever your hobby is, doing something, or even changing your field. Like, for me, it was changing my field. Like, it was a lot right away. So I feel like changing it. I was also on night shift, and I was a tech too. I was a nurse's aide for 2 years before I became a nurse. I was in the hospital probably now like 10 years. So I did that night shift for those 2 years. Then when I was a nurse, night shift for another 2 years. And I realized I'm not a night shift person.
I'm the opposite.
And like, at least you think you know.
But yeah.
I thought I knew, and I was like, oh yeah, I'm good on night shift. And then when I went to days, I was like, oh, this is normal? I forgot what it felt to be normal.
I thought like I can go to day shift for a little bit, but
it's different.
Day shift is like, it's different. Like, there's some people, like I've talked to night shift nurses that have been night shift nurses for like 40 years. They always say they call night shift a graveyard shift because there's a lot of health implications for staying on night shift for a prolonged period of time, like cardiac, diabetes, all these other things. But like every time I'm on day shift, because usually how it happens, if you are a night shift nurse and you're starting at a new facility, you still have to orient on day shift. So you orient on day shift for a couple months, and then you have a couple weeks on night shift, and then you're off orientation. When I was orienting in the ICU on day shift, oh my goodness, the amount of phone calls that you get, the interruptions. And then it's like families calling, the doctors are calling. Like, I'm like, when am I going to take care of my patient? Like, I'm tired of these interruptions. Night shift, you come on, you turn off the lights.
Chilling.
Turn off the lights.
Chilling.
You actually see your patients. You can talk to them for a little bit. You pass your meds. You have your routine. Hopefully, depending on your unit, they sleep. Most of the time they don't. Sometimes you get in a little fisticuffs with some of the dementia patients. Like, no, because like they'll wake up and they'll be like, I have to go grocery shopping or I have to go to work, and like you're
it's
like,
this term called sundowning. Like when they're in their unfamiliar place, like they're not home. So when the sun goes down, they just think they're at home. They go back to whatever that is like their comfort place, and they just
they're like they want to go back to their routine. So some people are very adamant, like I have to go to work and I have to go pick up Miss Betsy. Yeah. Like it's a whole thing, and then so. Yep. Or I gotta go see Tom about something like. No, it gets crazy, but at least like that kind of chaos is easier for me to manage. There's just a little bit too much movement on day shift for me. Even as a manager, like being a manager on day shift is too much. And I feel like the personalities are different too. Like night shift nurses tend to be a lot more lax, a lot more chill.
That's true.
Which is crazy because y'all wake up in the daytime and have a normal routine and still be aggy.
It's the older people. I hate to say it because I think I'm very chill, but like it's
definitely a generational thing.
It's definitely a generational thing because like I don't know. I do miss the crew on night shift though. That's the one thing. Definitely like I feel like you're more tight knit too because you have to use resources. On day shift you have everyone there. Like you can talk to the doctors. They're not at home. They're not sleeping. Like people, you have more resources on day shift. On nights you're just kind of by yourself and you figure things out. You got to call a bunch of people. You got to be the secretary. You got to be all these different things. So become a little family. Yeah.
And as it should be.
Yeah, you have to.
So let's talk about travel nursing. Let's dig into it because I know both of you guys do travel nurses with obviously different experience and so.
Oh, you want me to go? Okay. Yeah, I'll start. So I did travel nursing for a couple years. I did my first year of nursing as a new grad. Shambles because of COVID. So I was like, you know what? If everywhere is shambles, might as well make a little bit of a bag. It was a little tough because usually travel agencies don't want to take new nurses. They want you to have at least 2 years of experience. But because the whole country was in a crisis, they're like, we'll make an exception. I was kind of nervous because, like I said, you don't really feel comfortable in your nursing skin for at least 1.5 to 2 years. So I was like, you know what, I'll just take a med-surg or a med-surg telemetry contract and see how it goes. The first hospital that I did my contract was in Jersey, and they overhired a bunch of travelers. So I was chilling. The ratios were like 3-to-1 nurses ratio for a med-surg tele assignment, which was like, I was chilling. So I was like, okay, cool. It was like a COVID contract, I didn't really like that hospital because of like the policies and like their charting system was different. Like a lot of the hospitals in Pennsylvania and other states use Epic, and Epic is like very user friendly. It's very easy to use. It's really hard to like make errors on an application like Epic. But some of the other sites use like Cerner and Sunrise and like all those old ones that look like Windows 97. And they make you do like the med math by hand. And it's like sometimes like, it's like, it's just different. And like that hospital would like make you dual sign for like a sub-Q insulin, which is just like a normal insulin shot that you would give in the stomach, which is like, I was like, why do you have to dual sign for insulin? But you're not dual signing for heparin, which heparin is a high alert drug. It's a blood thinner that goes through the IV. And it's like people have died off of mistakes with heparin. So I'm like, the fact that this hospital doesn't require a dual sign for heparin is crazy. So I was like, my contract was only 8 weeks. And then I signed with another hospital after that. I would say like the biggest thing about travel nursing is that you don't really get a lot of orientation. They put you on your unit. You get oriented there for like a day. Usually they have you do your hospital education prior to your first day. So you're learning about their policies, their procedures. They're looking at your like immunizations, your paperwork, making sure that your licensure is up to date. Usually you have to like do your fingerprinting, background check, and all that stuff has to be done. The hospital will send you your contract, you sign it. They'll send you the information online, and then your first day you should have already prepared yourself, so that way you're only just orienting to your unit. Then after that first day or two, then you're on your floor on your own doing your own assignment. You should already know how to be a nurse. So that's like taking care of a diabetic patient is going to be the same no matter where you go. It's just that you have to be like protect yourself and making sure that you're up to date on the hospital policies and procedures, because some people do things differently in other facilities and you don't want to get got. At the end of the day, like you want to be able to protect your license. So that's like my biggest piece of advice, is making sure that you're always up to date on your policies of the hospital. And then I think another thing too is like for traveling, they have local travel. Some hospitals have in-house or in-network travel positions. And then there's like the long distance travel where you have to be a minimum of 50-mile radius from the facility that you're working at. So then at that point, you just have to make sure that you're duplicating your housing. So that way, like, when you do your taxes, you're like, hey, like, were you actually like staying at a hotel or staying at an apartment? So that way the government don't get you either.
Everything's got to match.
Yes.
So I currently travel nurse right now. I've been doing it for like a year and a half now. And I did, like Christelle did, like usually a normal contract is 13 weeks. So you can sign on for that. They have shorter ones, 8 weeks, 4 weeks. There's also like there's strike nursing, so you can work at hospitals that are union that end up going on strike, and then they bring in a bunch of staff. So that's like a whole different thing, because there's no one from that hospital actually working there. Everyone's a traveler, and like, you know, just everyone works together for that. There's also local travel, so you can do like surgery centers. It's not only hospitals. I've been doing that a lot lately too. With that, you're just going for like a day. So you can go for one shift, you can go for a couple shifts, and same thing with not a lot of training. Like, especially if you're just going for one day, they're not going to train you much. Like, you just need to, like, this is how you chart, bathrooms over there, meds are here, figure it out. Like, and you just go and you just ask people for questions like along the way and just figure it out. But I'm doing the travel nursing now, and I do like it. For me, I love to not be a part of drama and just like go to work, do my thing, go home. Like, I don't have to make friends. If I do along the way, that's great. I love that. But like, you know, I love to just like do my own little thing and like learn different places, different policies. I like seeing how other hospitals do things. I kind of compare and I'm like, oh, okay, I kind of like that. This is cool, you know, and I can bring that back. Like, I have a per diem job that I still keep now as I travel, which is helpful because travel is very unpredictable. Like, 1 minute there'll be a good contract, and then maybe you don't see anything for like a month or two. And you kind of need something in between, because travel nursing, you do make more money, but when you're not working, you don't get paid. We don't get PTO. We don't have sick time usually. Sometimes it depends on like how long you've been with the agency, but like a lot of times you don't have sick time, you don't have PTO, so you have to work to make an income. So for me, having that per diem was great. I can, like, if I need ACLS or like redo my certifications, I just go back to my per diem, do that, you know, and I can pick up in between. So
I think another good thing about traveling is that a lot of the agencies, because they are looking for nurses, that they'll pay for your licensure. So I was licensed in California, New Jersey, Washington, D.C., and Florida, and my agency paid for all of that. Of course, renewal is like a different conversation, but at least getting that license started, they'll take care of everything for you. My agency that I was working with, like, I had actually really great benefits. So I did get sick time. So when I was out, I was so mad because I went through all of 2020 and all of 2021 with COVID. Like, the second week of 2022,
that's when you got
that's when I got COVID, but I was able at least to use my sick time. And I think I didn't have PTO, but I did have sick time. And so I was able to take that 2 weeks off. Because if you like a hospital, you can just keep renewing your contract. And it's nice because, you know, usually the first contract, there's not really a lot of wiggle room. But as the managers and the people there get to know you as a person, they're a lot more flexible with you. So by the time I stayed at that hospital for like almost 2 years, just as a travel nurse. And so by the time I was maybe on my like second or third contract, I was only working Monday, Tuesday, Wednesday every week. I was not required to work weekends. I wasn't required to work holidays. Like you really, like Lauren said, get to like skate by a lot of the other policies that staff nurses are required to, because most staff nurses are required to work every other weekend. There's usually some sort of holiday rotation. Sometimes there's usually like a Monday, Friday stipulation, because usually Mondays and Fridays are the days that most units are going to be short. So as a traveler, you just kind of like just scoot on by all that stuff. And you do, at least I had a great experience traveling. Like a lot of my closest friends, I met traveling. So,
Yeah.
Did you have anything to add to that, or?
No, not like anything right now.
I kind of have like a question. For travel nursing, does it look good or better if you have been to different hospitals, or it's just like the amount of time that you've had? Like you said, you were at the one hospital for 2 years. Does that? It doesn't really matter, or does? Okay.
no.
I don't think it's a bad thing. I think, first of all, being a traveler in general is like a good thing, I think, because you can adapt to different situations. Like you can pick things up quickly. You're a quick learner. Like, I don't think that's bad at all. I think that's a good quality if you're doing it like well. But I think with staying at a place a long time, that's good because you built a relationship and they want to keep you. You can ask to stay and they could be like, we don't want you back.
Right.
So it's like a two-way street. It's not like,
Yeah. So it is a two-way street. Sometimes, with traveling, like people just want to get up and go. Like, oh, like, I want to be in this area for a while. It's nice. Once my contract's up, I want to go back home, or I want to go to Texas or whatever. I think the biggest indicator is if you get your contract canceled.
Yes.
Because at the one hospital that I worked at as a traveler, there were some travelers that got fired and they pretty much get on like a block list, and it's like a whole other thing. Also, depending on what's going on, it is poor taste to cancel your contract early, because pretty much like you're getting paid a little bit more, or a lot more depending, than staff nurses, because you're securing their staffing until they can get a staff nurse on board. Because typically the process is you keep a traveler, you do your recruiting and whatever to onboard a staff nurse, and then as that staff nurse is orienting, you can weed off the traveler, so that way you can like save a little bit money, because it is a little bit more costly to keep travelers on board. So to cancel your contract early is kind of just like, you're leaving the hospital in kind of like a bad situation with like short staffing and stuff like that. But on the contrary, there are, like, I've seen people post online, like they had to cancel their contracts because whatever place they were working at was unsafe, whether it was ratios, whether it was resources, or just like things that they didn't feel safe caring for patients over there.
Yeah.
Yeah. So, okay, that's really interesting. The travel nurse thing I feel like it's really picked up over the past few years. It's kind of relatively a newer concept, if I'm not mistaken. Just curious about what are some of the few things that make it easy. So like housing. I think that's one of the biggest questions in my mind, because you're doing 8 or 13-week contracts. Like, where do you go for housing? Also, what are some of the like systems you use to know that there's openings for those positions, those travel positions?
So a lot of travel agencies honestly will just text you. Like, even though I've been out of travel for like the last like 2.5, 3 years now, they're still like, hey, if you're looking for a travel contract, you can go to Nebraska. Like, I literally get text messages every day, and I'm like, hey, sorry, I'm in management now, leave me alone. Like, but it's like a constant thing. Like, they'll message you a couple months. So like, there's always openings everywhere. Like, I don't necessarily think there's a nursing shortage. There's so many nurses out there. I just think that the bedside is rough, and a lot of people don't want to do bedside anymore, especially after what happened in the pandemic. So that's like, there's a lot of openings there. So you really don't have to look. You can just like throw a rock somewhere and people will be like, hey, like, you have jobs. But usually what will happen is like you can sign up with an agency or multiple agencies, and you get assigned a recruiter, and depending on your skill set, your experience, your specialty, they'll be like, hey, there's some contracts here, like take a look, do your research, of course, and then they'll kind of pair you up with a hospital that they feel is a good match for you, or that you feel is a good match for what you need in that moment in time. As far as housing, when I did my traveling, I stayed at a hotel. But then as I stayed at that hospital for a long time, I made friends with another traveler, and then we actually rented like a little 1-bedroom apartment that we just split the rent. It was like a cheap little place that we just split, and it was just easier to do it that way. So bought like a microwave, we just got groceries or whatever. Our like electric bill was like $11 because we weren't
barely there.
We were barely there. We had a blow up bed that, you know, she was day shift and I was night shift, so it was like it was fine just doing it that way. And then once we tend to block our days, so once my 3 days were up, I would just go back home, and then usually we just missed each other anyway because our days were opposite. So like I would just never see her, and she would never see me unless we happened to be working on that same day or whatever. But so housing really wasn't too much of an issue. And then it's nice because the housing stipend and the meal stipend isn't taxed, so you can use that money like a little bit more flexibly. Like you don't have to use all that money towards your housing as long as you're getting something towards housing, I guess. That makes sense.
And there's a lot of different like avenues to go as far as housing. Like there's the hotels, Airbnb. They have this thing called like Furnished Finder, where there's people that are like renting out either rooms or like entire apartments. And it's all furnished, so like you don't have to worry about getting a blow-up mattress or a couch or anything like that. They just already have everything set up, and it's short term, so they know that you're a traveler. And it's not just nurses, like they have doctors, they have like
they have travel respiratory therapy,
ultrasound, techs. Like there's a whole bunch of things. There's not like a lot of people can travel, and it's not necessarily a new thing either. Like I always try to ask other travelers and like people that have been doing it for a while. I met this one nurse, he was like in his 50s, and he traveled like 20 years ago and used the same agency as me. And I was like, oh, I didn't even know it was like that. It's been a while. It's been like around for a long time. The pandemic made it like way more popular, and the pay was like insane. So like everybody crowded it, and that's the thing too. It's actually an issue now because so many people are doing travel nursing now. It's not like the pay isn't where it was. It'll never be COVID times. That was astronomical, but like because it's so saturated, they don't pay people as well either because everyone's trying to do the same thing now. So yeah.
So I have a question. For traveling, well, I know Christelle, like for you, like what was like your favorite place that you traveled to? And then we'll get to you. We can do you for your favorite place and your like where your ideal place, which I kind of know, but it'd be cool to. So for Christelle, what was the best place you feel like you?
So I only traveled to 2 hospitals. My one was in Jersey, and the other one was up in like Wilkes-Barre. So it's like so you know.
Nothing.
I'm indifferent. I'm indifferent. Even though I stayed at the one in Geisinger or for a while, it was like I was on a med-surg trauma floor, so it was a little bit rough in the sense that their acuity was a lot higher than what a normal med-surg floor is, because normally med-surg, you're doing vitals like every 4 hours or every 8 hours. Like sometimes I would get a trauma patient that's still like you're doing Q2 hour checks, and I'm like, why am I doing Q2 hour checks on a med-surg patient? That's not a med-surg patient. But they just did their acuity different, so it was just different. But I did enjoy like doing like the trauma patients on the trauma floor. My favorite place, like my favorite specialty to work was ICU. I worked ICU for about a year, and I loved it there. The patients are a lot sicker, but you have a little bit more time to do your critical thinking. Like Lauren said before, like as a new nurse, you're really just trying to bolster up your nursing skills and like learn about time management. And a med surg floor is about time management. Like if you have, it's like if Jimmy had 5 apples, if Christelle has 5 patients and this patient has 9 meds and this patient's incontinent, so you have to factor in like a bed change or like wound care, or if they have an ostomy or whatever, like there's like different things. Or if if this patient's sicker, like you have to be able to, as you're getting a report from the offgoing nurse, you're like making your plan in your head, like how am I going to map out my day, like who am I going to see first? If I go to Mr. Smith in room 3, I know he's a yapper and I'm going to be late on my meds. No, like you literally have to like take all of that into consideration. So like a med surg floor is like perfect for you to be able to like delegate, figure out your time management and do that. ICU is like you're doing the critical thinking, you're anticipating everything, you're like staying on top of like all of your drips. You're really only taking care of 2 patients, sometimes 3 if you're short staffed, but I found it a lot less stressful to have sicker patients that are like sometimes like these people are coding multiple times in a night, which is stressful in itself. But I feel like being able to focus on one person is way better than focusing on 5 different people that still have a propensity to still be a rapid response or still be a code. Yeah. Because just because they're med surg doesn't mean that their heart can't stop or whatever at any given moment. And honestly, med surg scares me more because they're not even on any type of monitor. That's why I like prefer telemetry, because at least
you can know
that at least you'll see like what's going on the monitor.
Yeah. And it could be worse. Like we have a friend, Crystal. She works night shift, and she can get up to 8 patients at night. Whoa. And nursing homes is like 30. Yeah, they're not as sick, but like they can be very sick, and you have like a lot of people, a lot of management. Like it's just a lot that you have to think about and take care of, and just stay on with time management. So
yeah, that LTACs are like another one too.
Yeah, long-term care facility. Yeah. I'd say for me though, I haven't been a whole lot of places. I've been to 2 hospitals, a bunch of surgery centers, but I liked my first contract. My first contract was like almost 6 months. It was in Morristown, New Jersey, and I've never seen a place like that. It's massive. Like it's actually bigger than Lehigh Valley. It's insane, so big, and like they just seemed on top of things. Like I loved how everything was set up. They just had a really good system as far as like getting people through the OR, prepping them, getting them out. It was just really cool. And they also had like, they did ortho patients, same day surgery. So like knee surgeries, hip surgeries, they actually sent them home the same day.
Oh, that's crazy.
Right. It is.
Wow.
It is actually kind of crazy. I was like, what do you mean you're sending them home? Like knees is one thing, but
I've never seen a hip same day.
We would send hips home.
That's actually kind of bananas.
They tried to send a bilateral hip home. Yeah. That I didn't like. Yeah. I was like, huh? But it was also like cool because I was like, okay, this is new. Like I thought Lehigh Valley did it all, but this place is really like, I'm going to learn a little bit. It's a little more involved. They had physical therapy on the floor too. So we would have these patients longer. It wasn't like just a couple hours and then they're out the door.
I see.
And then some people would stay too. So like that was cool. But also I just liked, it's nice when people are nice to you because not everybody likes travelers. They know you make more. They know you're only here for a short amount of time. And like sometimes travelers aren't great either. Like some people do travel and they're not honest. Like people lie to make the money. So they'll just, do what they have to do the bare minimum too. Like they're not going to help other people and then just leave. Like I always try not to do that. I try to, if anything, like, I'm going to kiss your butt. Like, be nice to me. Like, I'm here to help you. Please don't stomp on me. Like, I want to be, we don't have to be friends, but, like, let's be good coworkers. Let's be teammates. Like, let's get this done. And, like, I had the best experience there. I never really had a bad experience. Knock on everything. Knock on everything.
I haven't had a bad experience traveling either. Like, I think, if you're a good person, you show up to work and you help out and you're a team player, like at the end of the day, the staff knows, like, regardless of how much more you're making or whatever, they know that you're helping them out so that way they're not out of ratio. especially because I think there's only a few states that have like legally mandated ratios. I know California is like one of the biggest players in that, but I know Pennsylvania, they're still working on ratios, but there's nothing that legally says like for a low-level unit, you are to be capped at 4-to-1 ratio. So they can really push you to whatever. If you don't have the staff, you still, like, these people are still here, you have to take care of them. So at the end of the day, everybody knows that the travelers are there to help. But like Lauren said, I have come across travelers that like, you know, did not do anything for their patients. And sometimes it's like, it's very like scary and like detrimental things have happened. And like, hopefully those people like not only just were fired, but lost their licenses because what are you doing? But for me, like I said, I didn't have a bad experience, but now that I'm a manager and we, like my unit, we're really heavily reliant on travelers. Like we take care of our travelers. And so for Christmas, we got the unit like glass, like coffee cups that we got off Etsy that has like different like nursing things. And we did have a couple left over to give some of the travelers. And they're like, wow, like I've never gotten a gift from a hospital as a traveler before, because like they're not there for
they don't
long,
think about you like that.
But like those travelers that we have on our floor are excellent nurses, and like we love to have them on our floor. And like I couldn't really ask for better travelers. Like they really do go above and beyond. Great team players, and so they deserve to have that recognition too, even if they're not actually part of our staff. So
wonderful that you do that.
Oh, we never answered your other question. I just realized where we'd want to go. Me personally, anywhere that's warm.
I co-sign
Especially
that.
now that it's like January and it's 20 degrees outside. Like I want to be somewhere that's warm. Like short term, of course. I don't want to be like too far away.
I need to be near my man.
I need to be near my husband. But I would love to be somewhere warm, like anywhere.
I know. I saw some people doing travel contracts in like Thailand.
Yes,
like,
there's also international
travel. Like people be going to Dubai. Yeah, like I want to go international. I would love to do a contract in Hawaii, like of course somewhere warm, but it'd be cool to do international nursing as well, because I know people, you know, TikTok is a great resource. Like people will show you the date. No, TikTok. Probably still have it, but no, I remember watching somebody go in their process of how they were able to do like travel nursing in Japan, but they did it through like military, like working at the military base as a travel nurse, which I didn't even know you could do.
That's cool.
But
that's amazing. And not be in the military.
I think they had to do something. There's some finessing going on, but
because you can be a civilian on a military base, but I don't know about like I don't know.
A nurse.
That's cool.
But nursing is literally so flexible. Like even if like, so Lauren decided to go pre-op, post-op, but you can do like nursing informatics. There's like criminal investigative nurses. There's the sexual assault, like it's called SANE nurses, but they're like the sexual assault advocacy nurses. You can one of the travelers actually, she picks up Stogo from time to time. She has a spot across the street from the hospital, but she's like an infusion nurse, and she does like the dermatology and like cosmetology type nursing. So there's like so many things. You could be a nurse on a cruise ship if you want to.
Nursing is so vast. Like that's the lovely thing about it. Like even if you don't like the hospital, you are not trapped to that. Like there's so much out there. Just have to talk to people along the way. It's just so big. It's like there's so many things we don't even know about.
Yeah. And then if you want to, like, so for me, like one career path or trajectory that I could do is that now that I am in management, I can just work my way up the management chain, and I could, like, you know, be a CNO or something like that, where you're definitely away from bedside, but you're just making the executive decisions for the hospital. One of the participants in the holistic program is actually the vice president of one of the hospitals in my network, and she started off as a nurse. So, which is also like amazing that she's a part of the holistic nursing program as executive leadership of a hospital, but also starting off as a nurse. So you don't necessarily have to go to med school. It is definitely recommended going back to go to grad school, whether you get your MBA or some people go to nurse practitioning and then they have their own clinics. There's like literally so much you can do with nursing.
I love that. Thank you. As we're kind of winding down, one of my questions is just kind of take a little step away from nursing for a quick second and just learn more about what makes you ladies you. So if you guys wouldn't mind sharing a little fun fact about like what it is that we don't know, it could be anything, a hobby or, you know, a little hidden skill or whatever, we'd love to hear.
You can go first, Lauren.
A hidden hobby. I don't know. I mean, I like to work out. Like, we like to go to the gym. We like to take adventures too. Like, I don't know. We do crazy things. Like, we went skydiving last summer. We do zip lining, try to travel, and just like always do something new. So that's my thing. Always a new adventure.
Yeah, definitely have a travel bug myself. I guess maybe like a secret talent or whatever. I don't know if it's like a secret talent, but I was in marching band. I used to play piano and clarinet and things like that. So I really just love music. I don't know. I'm like one of those like people that just like, I love picking up a hobby like every couple of months. So like I picked up roller skating. Yep. Tennis is my new like, don't air me out now, but like I'll paint. I want to pick up crochet. I just like, you know, I have a little like hobby bug about me. So it's just nice to learn new things. I just am always inquisitive about things. So, and I think that kind of speaks to, you know, being a nurse. Like you have to love learning in order to be a nurse. So.
And I got a couple that Lauren didn't say about herself.
Humble bragging
She was a track star. She did track in college. She played volleyball. She played a little bit of soccer. Cheerleader. So like all these hidden talents. So you definitely have a lot.
Nice.
Yeah.
I love that.
But thank you guys so much. This was very informational. That's why I kind of got excited about this, because I know you personally. I know you because you guys are good friends, and just seeing how you guys have grown, like you especially when we first met, and just how we talked about you doing travel nursing and some of the headaches with it in the beginning, and then to see where you are now, where I'm comfortable that you're doing it and you're comfortable you're doing it, and just happy for you, Christelle, where you are now to like whole manager, making the decisions. It's awesome. And with nursing, like you guys said, like you can literally do anything with the title nurse. So just cool to hear, to share with everybody out there with Vlive. Thank you guys so much for coming out of your shell and killing this whole thing. All right, and that's all I have. Thank you. Thank you.